So the safety concerns are really quite minimal. Adverse event profiles were not much different than the placebo arm. We had slightly more fatigue in the treated arm compared to the placebo arm, which is ADT, which actually does lead to some form of fatigue on its own. We had slightly more falls in the patients that were taking the apalutamide, and we had a slightly higher risk of developing hypertension. So very manageable adverse events. There were patients that developed rash with apalutamide. There were patients that developed some minor hypothyroidism. Again, very manageable adverse events. And one has to realize that patients were on apalutamide about 3 times longer than they were on the control arm. And this, obviously being seen on a regular basis, gives us the opportunity to capture many more adverse events as patients are followed, because adverse events are only captured while patients are still on study, and patients were treated with apalutamide 3 times longer than with placebo. So in my personal experience, very well tolerated therapy. And we actually published a study looking at quality of life that I led in Lancet Oncology, showing that really there were no differences in patients that started off asymptomatic when we added apalutamide compared to patients who were on placebo. And if anything, over time, the placebo patients actually had worse quality of life because as they were progressing, symptoms were appearing. So very reassuring in terms of efficacy and also in terms of tolerability. Let me add one of the very important endpoints that is being reported at the present ASCO meeting is the overall survival endpoint. So I think everybody was very impressed with the metastases-free survival endpoint. But now, amazingly, even though the placebo arm were treated extremely early at first sign of metastases, we were still able to see a very significant improvement in overall survival. What that means is if we delay treatment, patients pay with reduced survival. If we wait until the appearance of metastases, patients live significantly less than when we start in the non-metastatic castration-resistant state. And we're not talking of a few weeks or a few months. We're talking 14 months improvement in the intent to treat analysis. And if you consider patients that crossed over from placebo to apalutamide, we're actually in about the 21-month range of improving overall survival compared to patients who started off without treatment for non-metastatic CRPC.